Hello, my name is Sharifa and I'm a dentist working in the northern suburbs of Melbourne. Every once in a while, I grab a cup of tea and talk to you about all the things that you wish your dentist had told you in plain English. Today we'll be talking about your first dental visit, what you can expect, how long it might take, what tests we run, and why we do those tests. Now, I know for a fact that going to the dentist for the first time in a long time, or possibly the first time ever, can be quite a daunting experience. So I hope that today we demystify that experience and curb some of that anxiety. Now, the first thing that we do when you come for a dental visit often starts in the waiting room. Often you are greeted by some reception staff and they give you a medical history. That medical history has a series of tailored questions that gather information for us that's important as dentists. Often you'll see questions about pre-existing conditions, about allergies, about medications. The reasons we ask these questions is to make sure that we don't give you any drugs that may interact with the drugs you're currently taking or things that you might be allergic to. Often people are allergic to dental materials and we like to avoid that. The questions about pre-existing conditions are often to help us manage you in the case of a medical emergency or to make sure that we don't do procedures that might be harmful to you. So for example, if you're taking a bisphosphonate or an injection for your osteoporosis, we know for a fact that we need to be a little bit more careful when taking out teeth. Things like that, so on and so forth. So when you walk into the dentist's office, that's probably the first thing they're going to check after they greet you is your medical history. The reason we go over it again isn't because we don't trust you, it is not because we want to reiterate or waste anybody's time, it's because we want to make sure that you understood all of the questions and that we've got the correct information. We want to do our due diligence to deliver the best possible experience for you and to make sure that you are safe, healthy and happy throughout the experience. The next thing we'll do is start to gather some history. Often we'll ask you why you're here today, what your dental experience was. Sometimes we'll ask you some questions about your life, your living situation, your job. The reason we ask these questions is not because we're nosy and not because we want to pry. It's often because we are not just treating a mouth. We are treating a mouth that is attached to a person, and getting to know that person gives us the information so we can give you the most tailored experience, the best possible tailored medicine experience that we can, and make sure that you're getting the treatment that's right for you. The next thing we'll do is talk about your dental history, what your experience with dentists is like. Often here is the opening for you to say, hey, I've maybe had a bad experience with a dentist before, I'm afraid of this procedure. And usually what your dentist will do is sit there and talk with you about strategies and ways that we can improve the dental experience or strategies that you might know work for you. Because I personally believe that nobody knows you better than you know you. So why wouldn't I take the information from you in the first place? The next thing we'll do is ask you what you're hoping to achieve. I mean, there's a reason you came to the dentist, right? These concerns can range from person to person. Some people say, I'm just here for a clean checkup, I just want to make sure I'm healthy. Other people will say, I haven't smiled in years, I want a new smile. Some people will say, I haven't felt healthy in a while, I want to feel healthy. Some people will tell me that they have toothaches, teeth that hurt, teeth that wobble, different sorts of things. Now, this is really important for us as dentists, but that's also really important for the patient. The reason it's important for both parties involved is because this is the foundation of the roadmap we're going to make later on in the appointment and throughout our experiences together. This is where you tell me what you want me to achieve for you, what your end game is. Once I know that, I know to think about those things while I'm doing the checkup. Once all of that information gathering has been done, what we'll do is guide you to the chair, sit you down, and lie you back. This is what's called the dental exam. The first thing I'll usually do is look around your jaw joints, make sure they're not clicking. If they are, we'll talk about that later in the appointment. We'll check your muscles of your face, if they're tense, if they're doing well, if there's anything sinister around there. Often we'll palpate your lymph nodes just to make sure there's no infections or anything that we should be concerned about. The next thing we'll do in the exam bit of the appointment is look at the tissues of your mouth. Look at your tongue, look at your cheeks, look at your gums, look at the roof of your mouth, look at sometimes your throat as well, just to make sure we don't see any changes in your tissue that make that are sinister to us, that we need to be worried about. Often what we're checking for here is mucosal conditions and oral cancers. Then what we'll do is we will look at your teeth. This is the part where we communicate with our assistant the most. You'll hear us yelling out numbers and letters and different kinds of weird jargon things. Now the numbers are the numbers of the teeth. Obviously for my assistant to know what to put on the chart, I need to tell her which tooth I'm looking at. Our teeth are obviously put into quadrants and then numbered. So when I'm yelling out numbers, what that means is I'm telling her, on the chart, can you please place this condition on this tooth? The letters actually refer to the surfaces of the teeth, and then words that come out that you might hear are caries, which means cavities, We'll say erosion or attrition, that means we see signs of grinding or signs of acid damage. All of this information is gathered and put onto a chart that the assistant is doing for us. Then what we'll do sometimes is measure your gums. Oftentimes we won't need a full chart, but we do like to measure a couple of places around the mouth to ascertain whether or not that full chart is necessary. So we'll yell out numbers. That's just a measurement of your gums. Measurements from 0 to 3 are generally healthy. Anything more tells us we need to gather more information. Then your dentist will sit you up. If it's your first time ever being to the dentist or you haven't been in a long time, we'll suggest some x-rays. This is usually where I get asked the most questions. This is where my patients say, okay, you've already done an exam. Why do you need to do an x-ray? Well, the reason I need to do an x-ray is because I don't have x-ray vision. What x-rays let us see is the parts of your teeth that we don't have access to with the naked eye. Often that's where your teeth meet. So what I'll do is I'll sit you up, I'll take 2 x-rays of your mouth. Sometimes I'll take more x-rays. Those x-rays will be specialized ones. So if I see there's a crown or there's a root canal or there's something I'm a little bit concerned about, something that I'm not sure is done properly or is healthy, or I want to just make sure is all in good order, I'll take some more x-rays. Those are called PAs or periapicals, okay? For the purposes of today's video, we just need to know that these x-rays are an information gathering exercise. Once those x-rays are taken, we will sit down together. Often I will go through the x-rays with you. I'll explain to you what the structure of the teeth looks like, what the things on the x-rays mean, and together we'll come up with a plan. Now, often on the x-rays what we're looking for is things like your bone levels, to make sure that your bone levels are healthy, that you don't have any kind of gum disease that's gone really far that we have to treat. We're looking for cavities. We're looking for signs of any other pathology that we should be concerned about. Often what I'll also do at your first visit is I'll send you off for an OPG or a big x-ray that you get done at the radiographers. Most of the time I'm checking for other pathologies in your jaw, just sinister things that I might need to worry about or refer you off to a specialist for, and for your wisdom teeth if they haven't been taken out. If they haven't been taken out, often we'll look at where they are, where their eruption path is. Depending on how old you are, we might recommend that you go to a surgeon to take them out. Some clinics will have a doctor in-house who'll do it for you. That just differs from clinic to clinic based on the skill sets of the clinicians that are working there. Once that's all done, we sit together, we talk about what we've found, what I found in your mouth, what I found on your x-rays, what I found while doing all of my investigations, and then we talk about where we go from here. We talk about what you need in terms of fillings, what you need in terms of crowns, bridges, root canals, dentures, replacement options for your teeth, implants, things like that. The thing to remember here is that this entire conversation, it's directed by you. I will tell you, okay, there's this thing happening in your mouth. You've got option A, option B, option C. This is what everything will cost. This is how we can do it. And then you'll tell me what you want to do and we'll make a plan around that. It's really, really important to understand that you are in control here. I am just here to facilitate our roadmap to get you to where you want to be. Once we've made a plan together, then we will start booking in a series of appointments for us to achieve what you want to achieve with me. So that's what happens in your first dental visit. Another thing we might do is might talk about your brushing, we might talk about your flossing, and we might actually talk about the way that you've been eating, so different kinds of sugar sources and things like that. We ask a couple questions about your diet, not because we like to pry, just because we like to know what's happening, to see if we can make any improvements. More often than not, this is an ongoing conversation, so it's not a conversation that we just have once. It's a conversation that we have at the beginning. What are you eating? Okay, let's see what changes we can make. We work together. If you think there's a change that you are not capable of making for whatever reason, then let me know. As a dentist, I'm happy to try and find alternatives. I'm happy to work with you. The best strategies are the ones that you will actually use. There is no point me giving you strategies if you're not going to use them. At the end of that discussion, once we have a roadmap, if we have time in the appointment, usually we'll give you a clean, then we'll make a series of appointments subsequently, and we'll bring you back to start your treatment. Hopefully this was helpful. There are variations on this, obviously. Every dentist is different, but in a general sense, that's exactly what happens in your first dental visit. Hopefully it was informative. Hopefully it curbed some anxiety. Thank you so much for joining me today, and hopefully I'll see you next time. Goodbye!